Stephen Brill is here. He wrote the cover story of this week's Time magazine. It is called Bitter Pill, Why Medical Bills Are Killing Us. It is the longest piece by a single author ever published by Time. It took Brill 7 months to research and write. He analyzes bills from hospitals, doctors, and drug companies to paint an extraordinary picture of medical overspending. I am pleased to have Stephen Brill back at this table. Welcome.
Thanks, Charlie.
What got you here? This longest piece.
Well, as you know, I like to pick topics where I just feel that I'm curious about them. And for a long time, I've just been curious about why healthcare costs so much. You know, we've had years of debate about who should pay for healthcare, how should we do insurance, and who should pay the bills. But I've never seen anyone stop to say, hey, wait a minute, how come it'll cost you $20,000 or $25,000 if, God forbid, you know, as you're walking out of this building, you slip and fall and land on your elbow?
Okay.
Why will it cost $1 million if you're diagnosed with cancer? How come? Who's getting the money?
Okay, but just tell me, you, because of all your interest, from the law to politics to education, come to this subject. Did you begin reading, or did Rick Stingel call you up and say we need a good piece on medical care costs?
I just like to pick topics. I didn't know anything about education when I started. I like to pick topics that I don't necessarily know anything about, that I think I can learn about. And everybody cares about healthcare, and everybody is affected by bills. And it just struck me that I'd never really read anything that said, okay, here's why it costs this much. Who's making the money? GE's making the money on the CAT scans, and the hospital CEO, it turns out, is making, you know, $2 or $3 or $4 million. That's the stuff I started to find out.
So you did that by simply doing what any good reporter does, go to the original source.
I just got bills. Everybody said, well, first of all, you're never going to be able to get bills because there are privacy issues. And I said, well, I'll promise the patients privacy, but some of these patients will be so angry that they'll beg me to put their names in, which is what happened. And then came the really hard part. The bills, if you've ever looked at a hospital bill, and you may not have because you have good insurance, the bills are indecipherable. They're in like double code. And no consumer can understand those bills. They're in acronyms and numerical codes, and line by line I just decoded them and figured out what they cost. For example, if one of the patients is getting a cancer drug from Memorial Sloan Kettering, I figured out how much it costs the hospital to buy that drug. The hospital was selling it to the patient for X thousand. It cost the hospital 1/4 of that or 1/3 of that, and then how much did it cost the drug company to produce the drug? Well, the drug companies like to brag to their investors about, you know, their high gross profit margins, which is great stuff if you're talking to investors, not great stuff if it's going to be in an article in Time magazine about how come this cancer drug, you know, is costing so much money.
I just want to quote from you, and we've already covered this point. You say, when we debate healthcare policy in America, we seem to jump right to the issue of who should pay the bills, blowing past which should be the first question: why exactly are the bills so high?
Exactly. And if you compare us to other countries, we spend, the price for prescription drugs in the United States is 50% higher. As a general matter, we spend much more per capita for healthcare than any developed country. That's the bad news. The worst news is our results are terrible. In that sense,
so we're paying more and getting less.
Yeah, in that sense, it is. It is a bit like the book I wrote about education, which is we spend more on education, the results are not as good. Here we spend much more on healthcare, and the results are not good.
Tell me about this concept of charge masters.
This was the thing, you know, among the categories of things that affect all of our lives that we never knew about, this would be high on the list. Every hospital has this giant list, 6,000, 7,000, 8,000 items, called the charge master. Again, it's all sort of in code and acronyms, but if a nurse gives you a cup to take a pill, the cup is listed in the charge master. The cup, the little paper cup, might be $6. If you get a chest x-ray, that's something else in the charge master. Every hospital's charge master is different. None of them are consistent. None of them make any sense. And most of all, there isn't a single hospital administrator who can explain how the charge master prices came to be, and none of them want to talk about it.
You have expressed this notion, too, that powerless buyers in a seller's market. where the only sure thing is the profit of the seller.
Exactly. Well, and that's why
Not
you
a
can
market,
have
is
a
it?
charge master. I mean, you know, you're wearing a really nice tie.
Yeah.
So if you walked into a tie store and said, how much is that tie? The first thing that would be different from the medical marketplace is you'd get to know how much the tie is before you buy it, which doesn't happen in a hospital. The second thing that would be different is if the person running the store said, oh, that tie is going to be $6,000, you'd get to decide not to buy it. You'd say $6,000 for a tie? Are you kidding? I'm not, not even Charlie Rose is going to spend $6,000 for a tie. The third thing that would happen is there might be another tie store up the block where you could look at ties. So there might be competition. Typically in a hospital situation or in a laboratory situation, the doctor sends you for a test or the doctor sends you to the hospital. You don't know what the prices are. And after you get the bill, you can't understand the bill. If you're insured, you may not care what the bill says. In fact, you'll feel great because your $6,000 tie will have been discounted by the insurance company to $3,000, and they'll pay 80% of the $3,000, and you'll feel terrific, except the only difference is the tie actually cost the hospital maybe $6 to make.
Over-testing is a big problem, too.
Oh, totally. It's a routine testing. It's a profit center for hospitals and for doctors.
And they do it because they want to, they know it's a profit center, but also because they want to avoid lawsuits?
Exactly. Or because they say they want to avoid lawsuits, but it's a legitimate excuse because there's rampant over-litigation in the medical industry, and the one place where the Democrats are totally at fault is, they are basically owned by the trial lawyers, and they resist all medical malpractice reform. This is an article that neither political party is going to love too much.
Democrats won't like it because you raise the issue of medical malpractice lawsuits and the litigious nature
and because I say that Obamacare does nothing to attack the core problem, which is pricing, which is why Obamacare was able to pass.
I'm going to get to Obamacare, but
and the Republicans won't like it because I say that actually the only efficient player in this marketplace is Medicare.
It's the only efficient player, yet a lot of people look at Medicare and say it is the cost element of entitlements that will bankrupt the country.
Well, what's going to bankrupt the country is the continuation of what we have today. Medicare, the situation I described where someone pays, well, if you look at the cover, the MD Anderson, the MD Anderson Cancer Center is charging $1.50 for generic aspirin or Tylenol pill. Okay, you can buy them on Amazon for 1.5 cents.
Yeah, exactly. So you can buy it on Amazon for 1.5 cents, and your hospital marks it up. You say here, 10,000%.
Right, but not to Medicare, because Medicare takes the view. Medicare is ordered by Congress only to pay hospitals for their costs, their actual costs, including their overhead and including everything else. So Medicare takes the position in this particular case that if you're paying $1,791 a day for your room at MD Anderson, which is what they charge unless it's intensive care, that they should throw in the aspirin for the $1,791 a day. Medicare would pay zero for that. And Medicare, again, pays hospitals their cost, including all their overhead. The hospitals say, oh, Medicare pays us much too little, but every hospital accepts Medicare patients, and in Central Florida or all the places where there are lots, where there's a high density of Medicare populations, they advertise for Medicare patients.
Okay, but do you agree that Medicare cost is one of the principal entitlement costs that unless reformed will bankrupt the economy?
Yes, but here's how to lower the cost. Lower the age of Medicare, not raise it.
You're opposed to raising the age so that you don't get Medicare until you're older.
If you want to save the taxpayers money in the context of Obamacare and our health care system today, I make, I think, a fairly cogent argument in this article that if you lowered the age to 64, there's a woman in here who ends up in the emergency room, Bridgeport Hospital, at the Stanford Hospital, who's 64 years old and 11 months, a month away from Medicare. She's got no insurance. Her bill is $21,000. Medicare would have paid about $800 for that. Now you say, well, okay, but the taxpayers would have paid the $800. She's going to pay the $21,000. First of all, she's not. She doesn't have the money. Second, Under Obamacare, she will be required to have health insurance. She will pay much higher premiums because the big insurance companies, Aetna, Cigna, you name it, pay hospitals much, much more for that service than Medicare does, because Medicare is, the big player in the marketplace. The insurance companies are really at the mercy of the hospitals, so she will have to pay a higher premium if she's 64. Mm-hmm. She won't be able to pay it. She's a school bus driver. Guess what happens? The federal government under Obamacare pays her premium. So they're going to pay a higher premium for her to have private insurance than it would cost them if she went into Medicare, because Medicare is such an efficient buyer. It costs Aetna $28 a claim to process a claim. It costs Medicare 89 cents a claim.
Okay.
It's just run that.
As you know, part of the political dynamic of America is that there's a feeling out there that is often engaged by politicians to say we need to take the government out of health care. And that was part of Obamacare and the debate that took place. Of course, the president was reelected, and it was not a political issue in the election as much as people thought it might be at one time.
Absolutely right.
But do you come to this favoring a single-payer system because of what you found in Medicare?
I think it's unrealistic to favor. We can sit here and have, I can write essays, and we can have wonderful wonk policy debates about single-payer. It's not practical.
Well, this is kind of Medicare for everybody.
But what I point out in the article is Medicare is the private sector. Medicare, there are 700 government employees working for Medicare and 8,000 private sector contractors. The difference is they operate under the supervision of the law, which says you can't overpay hospitals, and they operate under the supervision of long-time government civil servants who are actually really good at their jobs. But it is a private sector program. 8,000 private sector contractors and 700 government employees. So Medicare is not a bunch of, civil servants gone wild. It's not, and it really works well.
I taped the conversation here yesterday with Michael Porter, university professor at Harvard, at the business school, but
I know.
is, as you know, a very distinguished professor at Harvard who is fascinated and studying health care and many other things. Here is what he said, and I want to see what your reaction is to it. Roll tape.
Ultimately, healthcare fails the most basic test of organization, and that is it's not organized around the needs of the patient. It's organized around the supply of the services. And until we make that fundamental transformation, we are hobbled in our ability to actually so-called bend that cost curve, as people say.
Agree with that?
Yeah, I mean, it's even worse. I mean, he almost understates the problem. The problem is, as I conclude in here, healthcare is not a marketplace. The reason we, alone among all the developed countries on the planet, don't have government-run health care is we have a tradition, which I support, of free enterprise and a free market. All good. Except
if it's a free market.
There's nothing free about that market. Let's go back to you going into the tie store. You can decide to buy the tie or not buy the tie. You can choose what kind of tie you like. You can get price competition. There's no player in the current healthcare market, no buyer who has any kind of leverage over the seller except for Medicare, because they're so big. So you can start to do reforms such as cap profits on hospitals, stronger antitrust enforcement on hospitals, cap profits, for God's sakes, on prescription drugs. Why in America do we pay 50% more for the exact same drug than they pay in Germany, France, England? You pick your country.
Tell me why.
Because we alone don't regulate the price of drugs. We believe in a free market. Tell me what kind of free market it is. If, God forbid, I have cancer, you have cancer, and there's one drug that can stop my cancer, where's the free market there? Every other country has stepped in, and you know what? The profit margins for those pharmaceutical companies in France and Germany and England and all the other places, they're pretty high. They're high enough so that these companies are aggressively selling their drugs there, and they say, well, gee, we need the extra high margins so that we can do the research and development to develop drugs. Again, if you follow the money, as I did here, and you look at what they actually spend for research and development, their profits way surpass what they spend for research and development.
Define for me comparative effectiveness.